Thank you for joining us today. We have the pleasure of speaking with Renae and Jerry Rochon, and they're here. They are the owners of Valley of the Sun Health Solutions. And Valley of the Sun Health Solutions has 30 years of experience helping individuals and families navigate health plan options. They help people who are 65 and above and everyone else too. They are certified for ACA and Obamacare plans and Medicare health plans. As independent consultants and brokers, they work on your behalf. The goal is to simplify the complexities of healthcare plans and find the ideal coverage that meets your needs and budgets. The thing that I was the most surprised to learn is people who hire you, they don't have to pay you anything, correct?
Correct. Correct.
Excellent. Can you add anything I might have missed? I know, Renae, you have an amazing career in social work too that helps you with your position now.
Yeah, that's what I'm passionate about. I love helping people with whatever they need. So I was getting people food boxes or transportation or whatever else. So that gets to carry over into some of this into Medicare as well as underage 65 as well, just because I know the Arizona markets and a lot of providers as well. So yeah, it's definitely still a passion of mine. Just I get to do it in a different way.
Amazing.
And we also, we just strictly cover Arizona. So we know obviously all of the plans and the provisions in the plans, but we also have a in-depth, expertise on providers, on a lot of times our clients will ask like, who should we use for a primary care physician or, I mean, we can't really tell them who to use per se, but we can just say like, this doctor is very popular.
But yeah, we do know who's popular and who's getting good
Mhm.
recommendations. I think that's what Jerry and I have chosen to focus on just the Arizona market. There's a lot of people that, are licensed in 12 different states or 15, and that's fine if that works for them. But we really want to take care of people here in Arizona because we want to be experts in that.
Amazing. Thank you so much. And you, Renae, every time we speak, I can tell just how immersed you are in this and how much you know. So I'm going to jump into some questions. And if any of our
Okay.
participants have any along the way, please just write it in the chat box. I'm monitoring that, so we will get all the questions asked. Can you please explain what you do as Medicare and health insurance advisors and who do you help?
Start that.
Sure.
Okay.
So we help employees, we help individuals, we help business owners, independent contractors under age 65, and we help them with plans through the Affordable Care Act and a couple of other options that we have available for them too. And then we also help people that are on Medicare. And so those are people who are over age 65, but there are also some people who qualify for Medicare under age 65 if they have had a disability lasting for 24 months or longer.
Excellent. Thank you. And we kind of touched on this before, but how much does someone have to pay you to hire you?
Nothing. That's the beauty about using a health insurance broker, is that we are experts in what we do. We're experts in the plans. We're going to go to bat for you for everything, and we get paid by the carriers. Okay, they need help, with help, basically with directing people towards plans. Okay, with servicing, they usually don't have enough people on their end to do that. They want to keep their members happy, so that's what we're in partnership. Okay, with them, but we work for our clients. So if you're having a billing problem, if you're having something's not being covered, or maybe one prescription isn't covered or in a certain way, we have avenues to actually help people with that. We can sit on hold for 2 hours and do some of the legwork. Now, not always, not every single problem can we do that with, but it is definitely beneficial to have somebody on your side and somebody that knows the plans, because they change. Things are changing every single day, every single year. So that's our job, is to stay up on top of those things.
Yeah, and to go along with that too, the compensation that we receive is directly from the various insurance carriers. And the nice thing is that it's all standardized. So we do not have really any big reason why to place somebody with one company over another. So that's like just true independence and true working for our clients.
Amazing. I was shocked to hear that. I think that's such a great system to
A
have
lot
in
of people
place.
a lot of people don't know that, and it doesn't make
Yeah.
it any more expensive. Some people think that, oh well, if I'm using a broker, then my premium must be $50 more, whatever else. That's just not the case. It's exactly the same price whether you use us or not.
And you all have the extensive knowledge of knowing the different plans and what might work better for one family or person based on their health needs and what might work better for someone else.
For sure. We know what plans are going to be maybe more beneficial if somebody is going to have an upcoming surgery, or if they're a diabetic, or if they have some kind of other chronic health disease that might put them into the hospital more often. We have, sometimes people are always looking for what's cheaper, but we can look at on the long run in the whole entire year, this plan might look like it's going to be more expensive, but it's going to cost you less overall. But again, that's, using our knowledge.
Yeah, and then also taking into account geography, so if somebody is in the East Valley, for instance, there might be one plan that might be have more providers there, or it may exclude hospitals there. So that's why, a lot of times there's more to it than just, sending a quote to somebody. We like to do a needs analysis, based upon their own their own history, their own medical history, and then their own goals and objectives
Yeah,
as
in
well.
current circumstances.
Excellent. That's also a really good thing to think about, the geography and who's available where you are. Which kind of leads into our next question. What do I need to think about when enrolling myself or a parent in Medicare?
Yeah, so those are, some of the so if we have, like, for instance, we have clients who their kids might live out of state and their parents are here, or somebody just moved here, from another area, from another state. So in that other state, they may have had one company that they were using, but here in Arizona, that company may not be as competitive for them, so we always want to take a look at, who their doctors are, because you have to make sure that if we put them with one company, that those doctors are providers for that. We take a look at their medications, and we have a tool that we use where we plug in all the information, and then it just comes to us and puts into play, like, okay, you're taking these medications. So with this company, it might cost you $100, but with this company, it may only cost you $50,
Hmm.
because the companies they have formularies for prescriptions. So there's, so as long as like, especially when we have somebody coming into Medicare, aging in to age 65, a lot of times we can kind of create something for them on, this is what we want to try to do. And, we don't like to, we'd rather, like, manage the insurance carrier, than to try to, like, move somebody over all the time, because that's tough to do, but, like, some people have lots of doctors, lots of medications, and so we always want to make sure that we're checking all the boxes so that there's no surprises for somebody.
And then there's also sometimes, somebody might need a dental, situation where they're going to have, a really good dental reimbursement, or hearing aids. So you might want to go with a company that has, a larger value for those things, as well as transportation. There's sometimes the people that is going to be really important for them to get to and from their doctors, and they don't drive or they don't have family. So then that might, make us, like, look at a different carrier, even if something else is going to be slightly more expensive. So it's just a juggling act.
Are you saying, Renee, that some of the policies offer transportation? Or are you,
Yes.
yeah, wow. Okay.
Yeah,
And you know
they
those
they
policies.
yeah,
Right now they are.
transportation to providers, and a lot of them they'll like, for instance, there's one that might do like 50 one-way trips. And the
Wow.
reason why the one-way trip is important because if somebody, can't take, I always say my grandmother or my mother, somebody can't take her to the doctor, then the transportation does, and then somebody can pick her up or vice versa.
Hmm.
So, or, prescriptions, if you have to go there, they'll pick you up and do that. So,
Wow. I had that exact situation in my own family today, so I might be picking your brain about that, Renee.
okay.
Yeah, it's pretty important. And then there's I don't know if you want to talk about like Centerwell, Archwell. There's some places also that will provide transportation, like if you talk to them
Mm.
directly as well.
Okay,
So
good to know. When someone switches to Medicare or starts Medicare, can they keep their current doctor?
Yes, absolutely. I mean, we always look to make sure that we're lining up somebody appropriately with a plan that that doctor is a provider for. And when we talk about the plan, there's really, I'm not sure if we're going to get into that or not, but so there's the Medicare Advantage plans, and those are like they include, you know, hospitalization, doctor visits, prescription drug plans, and some extras in there. And then some people go a different way where they have just their original Medicare and then they purchase a Medicare supplement. And so as long like on the supplement side of it, for instance, it's really the only way that you can get in to see somebody at the Mayo Clinic is
Hmm.
to do a Medicare supplement. And typically, almost all providers accept Medicare, so you would not have to ever worry about, your provider not being on if you went that route. So those are
Okay.
kind of things that we do up front to really, that's why that needs analysis is very important to find out, what's going on. It's also very important when we do those to find out if somebody has an ongoing chronic illness, because, you know, somebody's 65 and we have plenty of clients that tell us we're healthy, there's nothing wrong, and
Mm.
it's, the inside voice is, well, right now, because
Yeah.
eventually, you need some oil changes or you might need a transmission on your body or
right, yeah.
whatever the case is. So yeah, yeah.
Once you pick something, once you pick your plan or the supplement also, is it easy or harder to change as you age and chronic illnesses start developing?
That's a great question. So if somebody initially, when they're turning age 65, if they do a Medicare supplement plan, which means you can go to any provider, anywhere in the country, not have to worry about networks, those ones, once you're locked in initially, you're locked into that. But the sometimes the premiums on the monthly amount goes up
As you age.
as you age. So some people, as they age, they'll transfer from a Medicare supplement into a Medicare Advantage plan. It's hard to go from the Medicare Advantage plan back into a Medicare supplement plan because once you get out of the initial underwriting, then you have to answer medical questions, and so that's what makes it tougher. But every year, people that are on the Advantage plans, it's coming up now from October 1st through December 7th. That's when they can make plan changes, and look at new options.
Yeah, so they have, if they choose to do an original or Medicare Advantage plan, they have 12 months they can go back and to do a supplement. But after that, then that's when they have to do the underwriting. And so if anything popped up, there's going to be like sort of like pre-existing conditions, basically. So if you have a cancer thing or a heart thing or whatever, there's going to be some things that they're going to not let you go back into. So that makes it a little bit more challenging, but if you're going from like Medicare Advantage plan to Medicare Advantage plan, for some reason,
It's easy.
yeah, that's easy.
Okay. Okay, great. What cost should I expect beyond my Medicare premiums? Is another question.
That's good.
Yep. So everybody that has paid into the the tax system over the years, you automatically, when you turn age 65, you automatically get what's called Medicare Part A, which is hospitalization, and then Medicare Part B, you do have to pay for that each month or quarterly, depending on what your how you get billed for that. And then the Medicare Part B premium, and this is important that a lot of people don't understand, is that the Medicare Part B premium, there's a standard rate for most people that make less than a certain amount 2 years prior to Medicare. But if you come off of, working and you have a, very good combined income, then your Medicare Part B gets a income adjustment on that. So it's more expensive. So some people, when they first turn 65, that number for the Part B premium might be higher, but then once they get into retirement ages, as their income goes down, that number goes off too. And then, in the plans that we utilize, most of the time when you go to see a primary care physician, a PCP, most of the time in the Advantage plans, it's a $0 copay. And then if they see a specialist, it varies from one company to another, but it might be anywhere from $5 copay visit, to $30 copay visit for specialists. And then there's some cost involved too with various tests, laboratory test results, things like that, and hospitalization as well. And all the plans too, they have a cap on what the maximum would be that you could potentially pay out in 1 year. And it's usually anywhere from $2,500 to $3,000. And you have to be pretty sick to hit those numbers. I mean, to get to that out-of-pocket number.
So for a supplement plan, you'll be paying so you'll be paying your Part B premium, and then for a supplement, you'll also be paying an additional premium per month. Like we talked about that goes up. But that doesn't cover like vision as well as dental. So if that's important, then you're going to need a separate dental plan as well and a prescription drug plan. So there's pros and cons to doing this and whatever else. On the Medicare Advantage side, that's usually taken care of. Like they have vision, they have dental, they have the prescription drug plan is going to be in that. Okay. But then you're going to have to stay in a network and things like that too.
Silver sneakers.
Oh yeah, sometimes you get the silver sneakers, you get some gym benefits and things like that, some over-the-counter things. So sometimes, every quarter you get a certain amount of money, $75 to spend on over-counter things. So they have some bells and whistles because they want to keep you healthy. They're really invested in, making sure you get to your preventative care things and whatever else. They want to manage costs on their side.
And if somebody, like I said earlier, if somebody we know is already has some pretty serious conditions, a lot of times we will push more towards using the original Medicare and a Medicare supplement, and then they have to get a separate prescription drug plan. But
in the long run, it'll be cheaper for them because their maximum out of pocket will be $254.
Yeah, and they can go to anybody that they want to go to. So again, kind of just a case by case basis.
Say like Medicare Advantage plans get a really bad rap. I know a lot of people are like, oh, don't ever take that and blah, blah, blah. My mom was on a Medicare Advantage plan and she had great coverage. We live in a very large city. Maybe somebody that's not in a rural place, might have, but even though you have to stay in a network, the networks are pretty big. Mm-hmm. There's a lot of options still. So I don't want anybody to think that that's not a good option. I think right now, we're probably 60-40, right? Or almost half and half, maybe. I don't know.
Yeah. It used to be when I first started doing it, it was probably 70% doing the Medicare supplement and then 30% doing the Advantage plans. And now it's probably 50-50 because a lot of times too, with the Advantage plans, even though like in the old days with snowbirds, right? We always have to have them on a supplement plan because you wanted to be able to have the same coverage, in Arizona as well as in Massachusetts, for instance. But now these plans have network, agreements out of the states too. So there's more of the snowbirds that go with the Advantage plans. So it's like so, and then one of the other advantages of the Advantage plans
Yeah.
is that there are no monthly there's no monthly premium for most of those plans. So if somebody's on a really, really fixed budget, then that might make more sense for them too. So
No, and I also want to say that sometimes people also give we get a bad rap as brokers that we want to push people into Advantage plans because we get paid more. Okay, I mean that's not really true. I mean maybe the initial payment or whatever else, but I really believe I understand that there's probably, non-ethical brokers out there, but we know a lot of brokers and nobody's putting people in plans that are really going to be bad for them in the long run just to get a few more dollars because we're not going to get referrals. Like that's how we're in business. We get referrals and we want to take care of people. So that's kind of just it's kind of a myth and it's something that a lot of people push and it's a lot of things that I see online even recently. So I just want to say that I just don't believe that's true, that's the reason that, brokers push those plans.
Mm-hmm. Yes, and I something you were saying about really looking at what makes the most sense for each person. That's the part of what you guys do that is so intriguing to me. I would love running those numbers. That sounds so exciting. Like just saying like, okay, which one is best for you and which one's best for you. Can you tell me what it looks like when someone first contacts you and wants to sit down with you and look at either a health insurance policy or a Medicare policy? What does that first initial meeting look like and follow-ups after that?
so most of the time for us, it's referrals. So we don't really, Renee's starting to do some of the marketing, but like for me, being an insurance broker here in Phoenix for 40 years, I have a lot of referrals. So most of the time they get referred to us from somebody, and then I, we have them either come into our office, or we also go, to their homes, and then bring all of our laptops and all our information. And then the first meeting is usually just one to get the basics of all of their demographics and their information, and then adding in the doctors and what's going on. And then, if somebody already has an existing plan, I mean, I always start off like, what made you go with, let's say Cigna, okay? What made you make that choice with them? And then, what are you unhappy with right now? Or what, and then a lot of times sometimes it's not, it's not really the company that's at fault. It's because whoever they may have had for their representation is not really helping them anymore, And so, like what Renae talked about earlier, I mean, we have to call in sometimes to an 800 number. But we have representatives with all of the companies, so like we can really help our people by kind of bypassing that, the member services thing, and then, be able to take care of them. But we just have those meetings like that. And then, there's some compliance things we have to do to be compliant with CMS, Centers for Medicare Services. And then same thing with the federally facilitated marketplace for the ACA plans. That's
Yeah, if we're gonna do a Medicare policy or even just talk about it, education or whatever, we're a face-to-face people for the most part. I mean, we'll do Zoom if we have to, or phone call, but really, especially since there's so many things that go into Medicare, it's just a lot easier to create that relationship, because we really do feel like we're going to be your partners for a long time, going on. And so we want to make sure that everybody's on the same page, that they, feel comfortable asking. And then we really get to know our clients that way. I would have to say for like ACA plans, they're a little bit easier. A lot of people kind of already understand, they're coming off of an employer plan, or they've known that or whatever. But really still it's still a fact-finding mission, what are you looking for? What's the most important thing? What's going on? Do you have things coming up? What's your budget? So
Our oldest, our oldest client is 102,
yeah.
and
Wow.
she just moved into independent living 2 years ago. And yeah, I've known her and her family, their business for 40 years. And so I've, out of them, I've been able to, to secure coverage for like so many family members, and that's kind of that's what we're all about, and there's times too where we review somebody's coverage, and we just tell them like, you have a very good
Right.
plan, like you should stay here, and we don't, obviously we don't get paid for that because they have somebody else, but then they in turn refer us to
Right.
people, because not many, I don't want to, toot our own horn, but not many people do that, and that's kind of,
Somebody's on a good plan. We also want to, make sure that nobody else comes in and tries to change them. So we try to like really make sure and tell them, don't let anybody else call you or, say that this isn't a good plan. This is where you need to be.
we both we both have lost, our parents in the last, 2 years. And
Mm.
so I look at a lot of time, although I'm getting up there myself, but I'm not in Medicare yet, but I look at our clients as being like, almost like, okay, how would I treat my dad here? Or how would I treat, my mother-in-law, and that's kind of how we do it.
That's amazing. And I'm sorry for the loss of your parents as well, you guys.
They
Um,
lived good long
They
lives.
did.
yeah. Speaking of your 102-year-old client, does Medicare cover any in-home health services or assisted living services or anything like that?
So Medicare covers home health care, and so it covers it for a certain number of hours a week. So that might include, occupational therapy, physical therapy, speech therapy. Think about somebody that has a stroke and they come home and they have to be taught, how to basically, live their life again, right, with that way. And then it also covers a little bit of like custodial home health care. So somebody might be able to come in and help out with some things,
Cleaning.
cleanings,
Okay.
but there's limits on how much they cover for home health care.
And they
Okay.
do like in my mom's case, they did an evaluation like every 2 visits and took her off before she could really bathe herself,
Mm.
So sometimes, it's difficult because, they're saying that she is good to go. And I'm like, there's no way she could do it without me. So there are some limitations.
And there's been a really, really big, huge push towards physicians and, FNP, nurse practitioners, who actually now do house calls again. And so,
That was amazing for my mom.
yeah, so people love that they can have somebody come in and they can draw their blood, they can do EKG. I mean, there's so many
Yeah,
things
there's a lot of things they can do. They can even do some x-rays. There's even dentists that, come in,
Oh,
will come in care now or in home care.
Yep.
So, but as for assisted living,
Yeah, so assisted living it's only covered for what's called skilled nursing facilities, which means that taking the stroke person, if somebody has a stroke again, most of the time they're going to go into like a rehabilitation unit or a skilled nursing facility. But it does not cover, Medicare does not cover long-term care. And so that's a huge, huge number, and we've spoken in front of 100 people, and I'll say, how many people here, raise your hands, have had somebody that has had to either go into a nursing home or have somebody come to take care of your parents at the house. And Medicare is limited as far as what they do for that. And it can be I mean, the price on nursing home care, depending on which level that you're in, I mean, some families are paying, seven, eight, $9,000 a month for that.
Yeah, my mom's where she was first voted for where her assisted living was, if she would have gone into memory care, started at $10,000.
Wow.
So yeah. So you do have to have another like a long-term care policy, or there are short-term care policies. I mean, I don't want to totally get into that now. If people are interested, they can contact me.
Yeah, and there's there's other, like we have, so we obviously you're a resource for us, but then we also have other resources as well. We have elder senior law partners that we work with. We have mortgage people that we work with, and so if somebody wants to get a little bit creative on thinking about how do we protect our assets down the road, those are conversations that are a must right now.
Yeah.
Excellent. And even speaking with you both about it, you've been there, done that, so you have some ideas and with your referral partners too.
For sure.
Excellent. Next question is, what are there any income-based programs that could help with Medicare costs?
Yeah, so if there's several. So one of them is in conjunction with Medicaid. So you have Medicare and then Medicaid. In Arizona, it's called Access, Arizona Healthcare Cost Containment System. So some people qualify for various levels of that. And it's amazing how many people don't know that program exists, so they're on a fixed income. So even though they may not qualify for the top level, they might qualify for one of the other ones, and they help with paying towards the cost of that Part B premium that we spoke about earlier. And it also helps with a big number, which is the cost of prescription drugs. So a lot of times, if a copay was $45 for a certain drug, with that, if they qualify for the Medicare Savings Program, it might only be $4 a month. So those are, when people are on fixed incomes, like those monthly prescription bills, if you can save somebody, $40 or $50, $100 a month, I mean, that's life changing, So yeah, we definitely explore all of the various programs with them, and those programs change every year too, as far as being able to qualify for them. And now, with the latest legislation bills that came out, which they seem to change daily, but yeah, we have to keep on top of that, and help people in that regard. Any others?
Yeah, that's pretty much it.
And when should someone get in touch with you both? When in their life?
Yeah.
Preferably when the roof is not on fire.
So for people who let's just take the under age 65 marketplace, we can enroll if somebody has what's outside of the enrollment period. If somebody has what's called an SCP, special enrollment period, then normally we can get them coverage the first of the month, as long as we have them, enrolled by the last date of that month. So a lot of times what we're seeing too is that, let's just take the 65-year-old who is retiring, and she's keeping her husband on her plan, and he may only be 62 years old. So that's where we'll really try to figure out, like, okay, she's going to go into the Medicare side of it, and then we're going to have to find a plan for them. So it's always like getting to age 65, because most of the time when people go into Medicare, the plans are better than the employer plans that are out there. Because, as being younger, the employer plans a lot of times have huge deductibles, right? And that, now they're going to something that's not like that. And so, so a lot of times people are surprised. But then for somebody that's turning age 65, I mean, I would like to meet them or get referred to them probably a year before, to start preparing them for these this is what you're going to have to do, and then another thing that we're seeing too a lot of is that, now, like I call them our class of 1960. Those are all the people turning 65 this year. So a lot of those people aren't retiring at 65. Their actual Social Security retirement age is until 66 and, 3/4 or whatever it is. So a lot of times we'll take a look and see like, okay, if you come off your employer plan, this is what you would be looking at versus staying on your employer plan.
And it helps the employers because, as you get older, you have a little bit more claims, there's more risk and things like that. So it actually helps them out by getting some people that are older off of their plan. It can be cheaper for them. And then it's also better for the person that's turning 65.
Yeah.
So, but yeah, I mean, anybody we've had a lot of people recently that are unemployed, got laid off or things like that, give us a call as soon as possible because there is a better plan out there than Cobra. It's super expensive, so we can help navigate that as well. It's too late when you call us and say you already broke your arm and then now you need something that's going to cover you retroactively. And I did have that in like last month. Cannot help you.
Wow. And then after age 65, are there cases when people should contact you as well?
For sure.
Yeah, absolutely. I mean, if somebody's new, if they move to the state or if they just move from Pinal County over to Maricopa or, whatever the case is. And then if, there's a lot of confusion about Medicare. Medicare is it's a good program, and it works. But sometimes the government sends information to people that makes it even more confusing. So anytime anybody's confused by something, or if their medical situation might change, or their financial situation might change, those are always good times to talk to us. And then, of course, the open enrollment period, the annual enrollment period runs from October 1st through December 7th. And that's when they can look at changing their Advantage plans.
And every year those Advantage plans change. So they they'll send out something that's called an annual, change.
We call them
ANOCs.
Yeah, they're called annual notice of change. And so that will tell like somebody like, okay, last year, this is what the co-pays were in this plan. This year, this is what they're doing, or, and so.
Yeah, or last year you got, this much for hearing aids. This year you're getting this. So some people just throw them away. They're like, I'm just going to stay on my plan or whatever. It's really good to know what's going on in those plans and what's going on in other plans, because maybe there is a better option for what's going on in your situation, or maybe you had a drug change and you are paying whatever it is, $50, $60 a month for it, but there's another plan that you could be paying 12, but it's going to be helpful if you talk to somebody like us that we can navigate some of that for them so that they don't have to look up Humana and Aetna. And, it's cumbersome to look at all of those things and then to make sure that their doctor's on it. If you have 10 doctors, it's pretty difficult and overwhelming to be going and changing. It's just easier sometimes to stay in your plan. But if you have a partner and that will do that for you and with you, then,
I had a situation with a new person that I met with 2 weeks ago, and they did not know that Banner was not one of the hospitals in their network, and they were not happy about that. So, but unfortunately, I can't really help them until the new plans will go into effect in January. And so but yeah, that happens sometimes. And that's another thing too. I don't know if you're going to ask about that, but a lot of times people always are saying we want our primary care physician retired, or there's only nurse practitioners or physician's assistants. And so when those annual notice of changes come, it doesn't really tell the people a lot of times whether or not their doctors are still going to be in that network, because the doctors groups, they're all getting bought by, venture capital, private equity groups, hospitals. So the whole whole group of urologists, for instance, that while they might be on Blue Cross Blue Shield's plan in 2025, they may not be on it in 2026. And there's nothing worse than finding that out that you've renewed your plan and then your doctor's not on that.
And then you can't do anything about it.
Yeah, so those are definitely the keys to making sure we match somebody up with the right plans.
Yeah.
Very important to note. And Medicare fraud, what should people be looking for?
Yeah, so whenever we call a client or even a referral during the open enrollment season, it's required by Medicare that we record all of the conversations. So first and foremost, if somebody contacts, somebody, they have to identify right away and say, this is Jerry Rochon on a recorded line. And according to Medicare, I'm licensed with this many companies with this many plans. And then, then after that, then we can kind of talk about the plans. And then another thing that people really have to watch out for is sometimes, somebody's at home watching a soap opera during the day and there's these commercials that come on TV and, call 1-800 whatever. And they kind of make it look like it's almost like Medicare. But I've had clients call into that number because they'll say like you can get $100 back on something, and then they end up, it's a call center, and then somebody doesn't know that they've changed their plan, and the person puts them on a plan, that person who's might be in Kentucky and they have no idea on which plans to put them in. So
So what doctors or what they're,
yeah, there's certain rules of engagement that you have to follow as a licensed Medicare person. And then, in Dr. Oz, he's in charge of, CMS now. So they're really, really cracking down on the bad actors out there, that have screwed people over in the last few years. But if it sounds too good to be true, it is, right? If somebody's really hassling you on the phone to sign up for something,
give them their Medicare number, etc.
Just don't give your information out. Don't give your social security number out, obviously. And then, sometimes what somebody can do too to prevent the fraud is say, hey, you caught me at a bad time. Let me call you back, and then see if they actually have a phone number to call you back. So
we tell our clients, there's a lot of people out there that aren't our clients, obviously, but hey, if somebody calls you and they're, pitching this plan or whatever else, at least run it by us. We don't mind you shopping, we don't mind, looking at other plans, but we'd rather have them shop with us, or, at least be able to tell them, yeah, this is legit or it's not,
Yes. Excellent. And Jill said, thank you, great info.
Good. Thanks, Jill. Thanks for coming and seeing us.
And do you have anything else to add before we sign off?
Anything else? We love doing education. I love doing education. So does he, but I'm passionate about that. I'm passionate about talking about this kind of stuff and helping people just learn more. So I would hate for anybody to ever think, oh, I don't want to call them and waste their time. We don't feel like it's wasting our time, even if we're not getting quote unquote paid. We want to have those kind of experiences. And again, I would want to help anybody that is in the, especially process of helping their parents, because we both did that, and my mom had Alzheimer's. So there was a point where she really did not understand. And then if you have somebody that doesn't understand, also trying to help your loved one, it's a lot, and you're already dealing with a lot when you're caring for parents. So let us help make it easier, just by even answering questions. We're good with that.
Yeah, the way that we conduct, there's no such thing as a dumb question, right? There's, and then, sometimes we have to, have some discussions about, some serious things. And these are kind of the choices that you have, but you get to that point with people because they've known us for a long time. And so they trust us, and I value that more than more than anything, because we don't look at it like this is a transaction, we are just helping people and enrolling them and, keeping the cycle going for down the road. So
Yeah.
Amazing. Thank you both. Thank you for
Thanks,
all the
Ashley.
amazing questions. And if you're here watching, you'll get a copy of this video that will be on YouTube with all the contact information when you are ready to contact Renae and Jerry. So thank you both.
Fantastic. Thanks,
And thank
guys.
you
Have a good
participants
day.
for being here. Bye.